The connection between diabetes and vision loss is actually quite significant. Diabetes is a disease that affects the small blood vessels mostly in the body. Patients sometimes will come into the office complaining just of blurry vision as their chief complaint. When we speak to them further, we find out that not only do they have blurry vision, but they're also urinating more frequently than they realize. They're also very thirsty. And these are very key, important signs that people may have beginnings of diabetes. And just like you can have problems in your feet and in your heart, kidneys, and brain, you can have problems in your eyes, because your eyes, particularly in the retina, has a multitude of very small blood vessels that can become leaky. They can begin to bleed. They can begin to proliferate, which means you're going to have creation of new blood vessels in the eye, which are not normal. And this can lead to swelling in the central part of the retina called the macula, which can lead to a clinical entity called macular edema. Swelling in the retina can be quite significant because it can decrease people's vision. It can decrease vision, making it very blurry. It can affect your central vision, and at the same time, if it's not treated properly, could ultimately lead to blindness. Diabetes also affects the rate of cataract formation in the eye, which is a very significant reason why diabetics need cataract surgery, usually at a younger age. The good news is about diabetes is that the better you can control your sugars, the less likely you are to suffer from the complications of diabetes. So one of the most important things that diabetics and patients who believe they might have diabetes can do is obviously to see their primary care provider, their internal medicine doctors, to make sure that their blood sugars are being properly controlled. But it's also crucial that they come and see the ophthalmologist or an eye care provider, such as that at Sinai-Grace and other DMC facilities, including the Kresge Eye Institute, where an eye care provider can look into the eye and determine whether there's any diabetic eye disease present and what appropriate treatments may be necessary. My best advice that I could give people who are either diabetic or think they may be diabetic is to definitely get your eyes examined and call us. We're here waiting and more than able to service your ophthalmological needs, your complete eye care. And it's really important that people get in and get their retinas checked and have a complete eye exam to make sure that there is no diabetes present in their eyes.